Facial paralysis or Bell's palsy. Sudden weakness in the muscles of one half of the face is Bell's palsy. Maybe a reaction to a viral infection. It rarely occurs more than once. It's characterized by muscle weakness that causes one side of the face to drop or one half of the face to drop. Bell's palsy usually resolves on its own within 6 months. The cause of Bell's palsy is unknown, but is thought to be caused by the inflammation affecting the body's immune system and diabetes.
Coming to etiology of Bell's palsy. First of all, incidence of Bell's palsy is more common in women than in men. It is more common in patients with diabetes. More risk is there in pregnancy. Cause of Bell's palsy is unknown, but there are some theories that suggest viral or autoimmune etiology. First, herpes simple virus 1 was detected in endoneural fluid and posterior angular muscle in patients with Bell's palsy, suggesting that reactivation in geniculate ganglion was responsible for most of the cases. Also, reactivation of varicella-zoster virus is associated with Bell's palsy in up to 1/3 of the patients. About one half of the cases attain maximum paralysis in 48 hours, and practically all patients within 3 to 4 days. In most of the cases, pain behind the ear may proceed in paralysis in a day or two. Then impairment of taste is seen in most of the patients, but it really persists beyond the second week of paralysis. Hyperacusis or distortion of sound can be experienced in the ears, which indicates the involvement of stapedius muscle. And all the features of the lower motor neuron type of facial nerve palsy is seen, which are dropping of corner of mouth, drooling of saliva from angle of mouth, loss of nasolabial fold, angle of mouth deviates to the opposite side, forehead will be involved, patients will be unable to raise the eyebrow on the same side of the lesion. Then there can be a corneal ulcerations due to inability to close the eye during sleep. Next important difference is acoustic neuroma. Unique feature of this is in MRI it shows ice cream cone appearance. This is due to extension of tumor to entacunicular part. Next difference is tumors that invade temporal bone. Example, karyotic body or tumorosis. It is usually diagnosed clinically after taking proper history. There is no particular diagnostic procedure or test for diagnosis of Bell's palsy. MRI often shows swelling and enhancement of facial nerve. Most important part is treatment of Bell's palsy. First of all, symptomatic measures should be taken, like use of paper tape to depress the upper eyelid during sleep to prevent corneal drying, artificial tears. Majority of the patients will recover if recovery starts within a few days. Poor prognosis is seen in patients if they have loss of taste sensations and hyperacusis. Those who recover may show signs of anomalous reinnervations like crocodile tears.
Its best known natural remedies and herbs are Aconitum nepulus, when one half of the person's face becomes paralyzed, especially after being exposed to wind or cold air. This remedy is extremely helpful. Agaricus, Cadmium sulfuratum, Causticum, Coculus, Nux vomica, Plantaina, also called Plantinum, Dulcamara, coconut oil, amla oil, olive oil, sesame oil, walnut and almond oil massage. Vitamin B12, fish, meat, poultry, eggs and dairy products are extremely helpful. Collagen herbs such as gotukola, bala, ashwagandha, garlic, hyaluronic acid. Hyaluronic acid is an important compound for collagen in the skin. Vitamin C is one of the best known vitamins for this disease. Aloe vera gel, ginseng, antioxidants, renitol, papaya, kale, berries, almonds, spinach, citrus fruits, mushrooms, pumpkin seeds and carrots are also very helpful.